Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Hydralazine. Its brand name is Apresoline. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So the mechanism of action of hydralazine's antihypertensive effects or blood pressure lowering effects are not completely understood. It's thought that its effect on blood pressure are due to its ability to cause peripheral vasodilation. It causes this by direct relaxation on vascular smooth muscle. In terms of indications for use, hydralazine is indicated to be used in the treatment of essential hypertension or high blood pressure. Now, before somebody was to use hydralazine, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to hydralazine or any other component of the product, they would not be able to use this medication. And this medication can also not be used in individuals who have coronary artery disease. Now, in terms of precautions, it should be noted that myocardial stimulation, including angina or chest pain, changes on an ECG, myocardial ischemia, or myocardial infarction may occur with the use of this medication, especially in patients who have underlying coronary artery disease. This medication must be used cautiously in patients who have mitral valvular disease because pulmonary artery pressure may increase. Patients should be made aware that anemia, leukopenia, and a granulocytosis have been reported. This medication must be used cautiously in patients who have a history of stroke, and it must also be used cautiously in patients who have advanced renal disease or kidney disease. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use hydralazine, they can expect to receive their dose orally. So if somebody was using hydralazine to treat hypertension, they would typically start off with 10 milligrams taken 4 times a day for 2 to 4 days. They would then increase the dose to 25 milligrams taken 4 times a day for the rest of week 1, and then another increase to 50 milligrams taken 4 times daily for week 2. For maintenance therapy, the dose would typically be titrated lower based on patient response with their blood pressure. If a patient was using this medication in the setting of congestive heart failure, they would typically use 25 to 50 milligrams 3 or 4 times daily, with a maximum dose of 300 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using hydralazine, so I'll go over some of those here now. Some patients may experience angina pectoris or chest pain. Others may experience edema or swelling. Heart palpitations are a possibility with hydralazine, as well as tachycardia or a rapid heart rate. Some patients may experience diarrhea, a loss of appetite, or nausea and vomiting. Some patients may also experience a headache with the use of hydralazine. Now, some more rare but serious side effects would be a granulocytosis, leukopenia, hepatotoxicity, or systemic lupus erythematosus. That's all we're going to talk about today with hydralazine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.